Okay. So I know that more people will filter in as we go, but we'll go ahead and get started. And thanks so much for being here. Today we are talking about the power of parent treatment. Maddie, can you go ahead and start sharing your
Absolutely.
slides? And I'll just chat here for a sec. I think it's so wonderful that society has really seemed to embrace the idea of therapy for kids. But everybody's default is often to just think of individual therapy and under that traditional model of a child goes in, talks to a therapist once a week, leaves, comes back the next week. And I think that there's a lot of people think that that model is going to fix all the problems, but the reality is that it's really not effective for every kid. It's not effective for every problem. And there are many alternative approaches out there, and some that are actually more effective in treating certain kinds of problems for kids. So, parent oriented treatment is one of those. And Maddy Clark, who's here with us today, in our practice, she's an expert on these approaches, and she is going to share what she knows. I am Dr. Mandi White-Ajmani. I am the owner of Small Brooklyn Psychology. We are a group psychology practice at Industry City in Brooklyn, New York, where we offer therapy and neuropsychological assessment for people of all ages, all backgrounds, and all psychological concerns. You can see at the bottom of this slide here, this is our lovely and very photogenic team. It's me, Natasha Brown, Rebecca Abbott Sinclair, Sam Janeet, Maddy Clark, who's here with us today, Nav Gill, Cecilia Barbosa, Megan Moxie, Caroline Carberry, Olga Fuller, Amira Hanna, and Danielle DeFilippo. We all have experience working with people across the lifespan, and we do work with teens, adults, even older adults. But we have special training and experience to work with children and parents using evidence-based assessment and treatment. Now, a big goal of mine at Small Brooklyn has always been to try and share what we know, to reach out to the community and to be a resource as much as we can. Even if you don't work with us directly, I really want to be involved in helping people to reach care, but then also to learn some of the good information that we know about psychology, about treatment, and about how to help kids and families. One of the ways that we do this is through webinars with our longtime partner, Park Slope Parents. And Park Slope Parents, I believe most of you are members, but if you are not, I highly recommend you go and check them out. They are really the OG resource in our borough and across the country for getting information to parents, good, supportive information and advice. We at Small Brooklyn, through our series with Park Slope Parents, have developed a lot of webinars for all kinds of different topics, from managing behavior at home and in a classroom. Maddy has talked about that in the past, to what a neuropsychological evaluation is and how it helps, to what are twice exceptional kids, how do you help girls with ADHD, what should we know about kids with obsessive compulsive disorder, what does marijuana use really do for the teenage brain. All of these talks are available for free on our website at smallbrooklyn.com/services/talks. So now we're going to turn to the idea of parent treatment. What does that look like? How does it work? What and why would we ever do treatment for a child without the child actually in the room? So Maddy Clark is going to talk about all of those things. She's going to lead this webinar. She's been one of our parenting gurus on the therapy team for the past 4 years. Is it, Maddy? 5?
Five,
Four or five.
almost started the fifth, I guess, four to
Time
five.
really, time really flies. All right. Maddy Clark, LCSW, that is her married name. She was formerly Maddie Lawler, so you may have heard her by that name. She is a licensed clinical social worker who specializes in providing evidence-based treatment for children and their families. She treats children with anxiety and behavior disorders and has special expertise and certification in implementing a kind of therapy she's going to talk about today called Parent-Child Interaction Therapy, PCIT, which is the gold standard intervention for treating disruptive behaviors in children between 2 and 7 years old. Maddy has her undergrad degree from Middlebury College, and she works as a special educator at the Ideal School in Manhattan for a few years before getting her MSW at Hunter College with a specialization in children, youth, and families. She has experience working with kids, teens, and families in public schools, at the Child Mind Institute summer program, and in private practice. Maddy has extensive experience and training in a variety of behavioral therapies. So here come all the acronyms. We've got PCIT, Parent Management Training, PMT, and Supportive Parenting for Anxious Childhood Emotions, SPACE. You will hear about all three of those today. as well as the avoidant restrictive food intake disorder, ARFID, adaptation of space. She has experience working with exposure and response prevention for obsessive compulsive disorder, cognitive behavioral therapy, of course, and an ARFID adaptation for that as well. She does individualized school support and consultation. She has a particular interest in providing parents with skill-based support to manage challenging behaviors related to anxiety and emotion dysregulation. She provides families with individual treatment, parent support, school consultation, and live interactive coaching with parents, children, and educators. She lives in Brooklyn with her family, and she loves exploring new restaurants and seeing live music, which is awesome. So take it away, Maddy. I'm going to turn off my camera and we will come in at the end of this talk to do some question and answer. Some of them are things that you guys have written in when you registered for this talk. Some things we will answer live. So if you have any questions, please chat them to me in the Q&A box and I will be monitoring that as we go. Thank
Awesome.
you.
Thank you so much, Mandi. Thank you for the kind introduction. Like Mandi said, am Maddy Clark, and obviously I have lots of experience working with kids, as you could tell from my background, but also just being at Small Brooklyn. And I love it. I wouldn't be in this job if I didn't, but I do have a particular passion for the parent-focused work, the parent-specific interventions. As a social worker, I'm thinking a lot about how people are in their environment. And so you guys as parents are a huge part of your kids' environment, right? So there's obviously the school piece, which is another fun interest of mine to collaborate with the schools. But as parents, you guys are spending tons of time with your kids. And so we're going to talk about why parent-specific interventions are super helpful. But that's a big piece of it, right? Is that you guys have lots of access to your kids. Mandi mentioned that once a week, 45-minute session with an individual therapist, which does have a lot of benefits. And we'll talk about like where individual therapy is indicated too. But you guys spend way more time with your kids than I ever do. And so it can be really helpful to empower parents to use these tools in order to address some of the things that might be happening at home. So parent-focused therapies are ones where we're working primarily and sometimes exclusively with parents rather than directly with the child. And this is because you guys are a powerful agent of change in your child's lives. And so throughout the presentation, I've included some well-known parents, some images of well-known parents in our media, just to kind of spice it up. It's lunch hour, right? It's the middle of the day. It's a Wednesday. And, they're not always related to the content, but I think it's helpful to think about parents that you may know and what big of a role they play in their children's lives, like these characters too. But yeah, so we're thinking about in parent-focused therapies, the child is still the client, right? So we're thinking specifically about the child's behaviors or presenting problems, but the work is with the parents. And the research really is there for these types of interventions. We can improve outcomes for the child working with parents modifying their behaviors or specific elements of their environment or those family dynamics. So when we're thinking about what parent therapy is, it is support, psychoeducation, some live coaching, depending on the intervention, problem solving. Ooh, I just need to change my view. Sorry about that. Full screen. Oh, just kidding. I'm so sorry. Here we go. Okay. We are thinking about support, psychoeducation, coaching, problem solving for those parents experiencing those challenging behaviors. We're mainly going to be talking about anxiety, ADHD, and other diagnoses, anxiety and ADHD, but also some of those other diagnoses as well. And so we want to be thinking about how it's still child-centric. The child is the identified patient. Sometimes parent-focused therapy provides us that into therapy for those families where the children are more treatment resistant. I'm so sorry. I just want to make sure that I have the correct view here. Sorry, Mandi.
It looks good on our side, Maddy.
Oh, it does? Okay, cool. I'm going to reshare then.
Yes, perfect.
Thank you. Sorry about that. All right, thank you. Okay, so that is what parent therapy is. It's we're giving that support, that psychoeducation, coaching, problem solving. And I think it's really important to also think about what parent-focused therapy is not. So there are different types of interventions where parents are engaged in therapy with their kids. That is an example of family therapy. Parent focused therapy, we're working primarily and often exclusively with the parents. So a lot of times kids aren't, I never even meet the kid who I'm talking for hours at a time about. With family therapy, we're focusing more on the family unit. There are a lot of theories that are present and relevant for family therapy and parent focused interventions like what Mandi mentioned, parent management training, parent child interaction therapy, and supportive parenting for anxious childhood emotions. There is a lot of basis in family systems theory, but it is not a space where we're specifically exploring the family dynamic, right? We're thinking about what presenting problems show up for children and ways that parents can support them with that. Certainly, there are moments where we're thinking about the parent-child dynamic or the whole family dynamic, how it's impacting siblings, how it's impacting all of those relationships. But the work is with the parents for the child, in service of the child. Even though in many of the situations I'm working with couples exclusively, it is not couples therapy. It is not a space where we are focusing on you as parents, as the identified patients, and your specific presenting problems. Again, there are elements of couple relationships and that dynamic that might come into play, but I'm always bringing it back to the child and that piece of it. That's a different type of therapy that I do not engage with, that I do not provide, but it is sometimes a recommendation depending on how we're seeing different things pop up with different dynamics. But this intervention, again, where it's focused on the child and the work is done with the parents. Another thing that it is not is co-parenting mediation. A lot of times I work with uncoupled families as well. And it can be a really effective way to kind of make sure that parents are providing tools consistently between both homes, again, where the child is the client. But it is not a specific place where we're sorting out any of the parental conflict. So where while it can be a place where we're thinking a lot about the specific interventions that might happen and how they might look different in each home, we're still thinking about that core consistency and those core strategies, but it is not, again, involving the couple dynamic. It's where the child is the focus. All right. So, as I mentioned, we're going to be thinking about how these interventions are helpful for kids with ADHD and kids with anxiety. We'll talk a little bit about some overlapping diagnoses there. But let's start with ADHD. So, ADHD, attention deficit hyperactivity disorder. The symptoms are inattention, hyperactivity, or impulsivity. There's two types, technically three, I guess, of ADHD. ADHD-I, where the symptoms are primarily the inattentive type, and then ADHD-H/I, where the symptoms are predominantly hyperactive and impulsive, and then combined type, where there's elements of both. I have some evidence or some data here rather on the prevalence of these diagnoses in school age children. Again, it's a bit of a range in terms of where the data comes from, but we can see that it is certainly a prevalent diagnosis for lots of kids. Specific challenges for ADHD come up in behavior regulation and family stress. And so this is the space where we're going to get more into why parent interventions are helpful for ADHD, because I think a lot of times parents are thinking about, well, if my kid has ADHD or symptoms that look like ADHD, shouldn't they be in a space where they're building up their own toolbox for behavior regulation and emotion regulation? And while that's true, that often can be a useful thing for kids to do, a lot of times kids have a really hard time generalizing any skills that they use, that they learn rather in individual therapy, whereas parents are with them a lot of the time and can be real agents for change in supporting them with those strategies. And in my office once a week, we're not seeing the same challenges. We don't have the family dynamic to contend with, right? And so a lot of times it is really supportive to think about how parents can react appropriately to those behaviors as they pop up, and the dysregulation, of course, as well. Um, with anxiety, we're thinking about symptomatology such as excessive worry, avoidance, any sort of physical somatic complaints, significant prevalence as well, where we're looking at that. And the challenges can obviously pop up in a bunch of different ways: school refusal, family accommodation, and any sort of impact on kids' independence because of that fear and the way that that presents itself. And so, certainly, again, it's helpful for kids to feel like they have the tools to confront and manage those uncomfortable feelings as they pop up. And there might be ways in which the family system is accommodating that type of anxiety, which we're going to get into more specifically when we talk through the SPACE model, the supportive parenting for anxious childhood emotions. But you can really see how, if we're thinking about like things like school refusal or ways that it's impacting the family, that if we're able to change the way parents are responding to it, it might actually encourage some of that bravery that we're thinking about. All right. So when we're thinking about why parents, right, I'm going to get into the more specifics of that. In general, you guys are much better at adhering to treatment than kids are. We're not just talking about showing up to treatment, but we're thinking about using those skills and those strategies in a way that feels effective. And so, you guys have, as parents and adults, fully developed frontal lobes. That really helps. And so, we're thinking about how you're better able to generalize those skills to real life situations. One, because you have the capacity to do so, right? But also because you are living in those real life situations where you are noticing the moments where the ADHD, and the anxiety are really impairing. And so it's helpful to think about how we can give parents those tools and strategies for when part of my friend's shit is hitting the fan, right? Like for me, in an individual session with a kid, we're kind of faking it, right? We're thinking about like, well, what happened in the last week that we might be able to think of strategies for in the future? And how can we do that? And then I'm kind of relying on the kids to, remember the skills and act on them in the heat of the moment, which, quite frankly, I talk about this all day long and I barely do, right? And so it's more likely to see success if we're coaching parents on how they are able to use those strategies in those moments where the heat is on too. And you can kind of coach and support kids to act on certain behaviors by changing your own behavior. We also, the research talks a lot about how changes in the family system specifically can enhance the sustainability of the intervention, meaning that if we're making the changes on a systemic level within the family, they're more likely to be effective for longer rather than just relying on the child as an individual to implement the skills in a long-term strategic way. And so, I think that we often think, like I said before, about how empowering kids for change can be really powerful. But I think that there are a lot of places where that tends to fall short. And so that's where it can be really helpful to kind of engage parents in using those skills and strategies. So diving into ADHD and anxiety specifically, because there's slight differences in how that looks. For ADHD, individual therapy doesn't necessarily lead to better self-regulation in kids, right? A lot of times we might be building up their individual toolbox for those self-regulation skills, But it's not necessarily effective in doing so, right? Because again, in that individual therapy space, we don't have the high stakes. And so instead, we're thinking about the way that that dysregulation shows up in the parent-child relationship. And how it can create this really negative cycle. This guy Patterson in the 80s named this the coercive cycle. And it talks about how when a child engages in a problem behavior and the parent responds negatively to the behavior, what ends up getting reinforced is the negative parent-child interaction. Whereas if we can instead coach the parents on how to better respond to the problem behavior in the first place, we cut off that cycle from the get-go rather than letting it escalate up. And so, we talk a lot about this in the interventions for ADHD, where we think about if we're able to model for children ways to better self-regulate and we can ride that wave with them, that's actually a much more effective way to learn those strategies. Because ultimately, the way that kids learn those strategies is by living through them and experiencing the fact that they can tolerate the distress, that they can manage those big feelings and come out on the other side of it. But sometimes we need to live through them, and there is not a space for that all the time in individual therapy. And so by learning those behavior management strategies, instead what we're doing is reducing the coercive cycle kickoff and instead reinforcing problem solving and positive parent-child relationships. When we think about it in terms of anxiety, parents often unintentionally reinforce avoidance. Here's an example of this. Let's say a kid has a dog phobia, and there's sort of a spectrum of parental responses to children's anxieties and fears. On one end of the spectrum is the demanding parent, and the demanding parent says, "Buck up, it's Brooklyn. We can't avoid dogs. They're everywhere." That approach lacks some empathy because it's requiring and demanding bravery. But it is actually encouraging the child to face their fears. On the other end of the spectrum is what we call the empathetic parent. And the empathetic parent says, "You're afraid of dogs? No problem. We'll cross the street every time we see one. We'll make sure that when we go to grandma's house, the dog stays in the basement. Whenever we have a play date, we're going to make sure that they don't have a dog or that the dog is elsewhere." And that's a really empathetic response because it thinks about how hard it would be for the child to be in a space where they're confronting something that really scares them. And this is a really natural response for parents because we don't like to see our kids distressed. And so we think a lot about ways to reduce that. However, that empathetic response ends up accommodating that fear. What you end up telling the child is that you actually can't handle being around dogs. Dogs are too scary for you, which is not often where parents are coming from, right? Like they're not coming when we have that empathetic response, we're not trying to tell them that they are not brave, right? But that ends up being the message, right? It says like you actually can't confront and face those fears. And so instead we think about a supportive response, and the supportive parent is somewhere in the middle of that spectrum. The supportive parent says, "I know this is hard for you," empathy validation, "and I know you can handle it," encouraging bravery, encouraging confidence. Because I'm going to assume that all of you want your children to have grit, tolerance, resilience, perseverance. And the way that kids build up those qualities is by seeing that they can handle those uncomfortable feelings, right? That they can confront their fears and live to tell the tale. There's a lot of evidence of this in individual therapy for anxiety and OCD called exposure and response prevention, right? Where it thinks about being exposed to specific things that scare you. And so what we think about is how, with the parent piece of it, a lot of times certain fears that kids have, parents end up playing a role in accommodating it and kicking off that cycle of accommodation, where if a kid knows that they can avoid a dog every time, they're being told that it's too scary, but they also are kind of finding that comfort and reassurance in continuing to avoid that fear. And so if we're able to change parents' behaviors and reduce the amount that they're accommodating, we can actually change kids' anxiety responses and symptoms. And so the space intervention, the supportive parenting for anxious childhood emotions intervention, talks a lot about that accommodation reduction. And so this is why a lot of times, like, we think about, well, the kid needs to face their fears, and that's how we treat anxiety, and that's where all the evidence is. But there are lots of ways that parents play into those specific anxieties that we can confront and change. Whether it is not crossing the street when you encounter a dog and instead practicing confronting the dog. It could be in terms of school refusal, making sure that there might be certain accommodations that parents are making in terms of allowing the child to stay home, or driving them in late, certain things like that. There are other ones in terms of, a lot of times anxiety presents as reassurance seeking, where kids ask parents to make sure they let them know that they're coming home at a certain time, but they're asking 10 times, right? And so being able to address parents' behaviors and say, like, I'm only going to tell you one time what time I'm coming home, and I know you can handle it, helps kids confront that uncertainty that we all deal with. But the change is actually happening in the parent's behavior, right? So that's again why engaging with the parent in a space where the child is the focus of the therapy is a really effective way to change the child's behaviors and promote that positive change. So we are going to talk specifically about parent management training, PMT, as a specific intervention, parent-focused intervention. So PMT is all of the interventions that I'm talking about today are evidence-based interventions. And so what that means is that there have been a lot of randomized control trials that have proven that the types of skills that you learn in these types of interventions are effective in changing children's behavior. And so in that way, these approaches are somewhat manualized, right? So I use the word structured, right? So there is a specific structure where you're going through sets of skills, specifically focusing on reinforcement, consequences, behavior tracking, in order to address those externalizing behaviors. What do I mean when I talk about externalizing behaviors? I'm talking about things that are maybe disruptive behaviors, like any sort of aggression, physical aggression, verbal aggression, eloping, running away, any sort of talking back, yelling, screaming, that type of thing. And so while all of these interventions are manuals that you can, go out and purchase on your own, obviously working with a therapist is one way to personalize those interventions, and make sure that the skills that, at the, kind of the top or the core of what we're thinking about do fit into your life, right? And that you can use them in a sustainable way. And so we're thinking about using the structure of PMT, but we're thinking about applying it to the specific behaviors that you guys are noticing. And so the core components that we go through are setting clear rules and expectations, any type of positive reinforcement, consistent consequences, and ignoring minor misbehaviors. So I kind of think of this like a flow chart, right? So the idea is that we're kind of starting with positive antecedents. How are we setting ourselves up for success? One way to do that is to set really clear rules and expectations. And again, we're thinking about this from the parent role, right? That the goal of this is to think about the parent's role and how it can be effective in changing behavior. And so What can parents do? They can set clear rules and expectations. A lot of times I like to talk to parents about how we are frontal lobe coaches. Kids are still developing their frontal lobe. The frontal lobe holds a lot of like executive function, working memory. So they need lots of reminders. We need to set those rules and expectations a bunch of times. The example I love to give is that when I was a kindergarten teacher, every single day when the kids came into class, I reminded them to wash their hands every single day until April. And that was kind of when they got it. So giving that, and it feels excessive, but that amount of consistent expectation setting is really important for kids. Sometimes the benefit of that too is that like when we're setting really clear rules and expectations, it gives us kind of like a leg to stand on when we need to enforce them, right? Where if we are sure that we have set the expectations in a really clear and appropriate way from the get-go, it makes us feel better about holding our ground because we've talked about that being the expectation. And then from there, once we've kind of set the clear expectations, if we're noticing positive behaviors as a result, we focus a lot on positive reinforcement, praising those specific behaviors. We talk about giving specific labeled praises to reinforce those positive behaviors. Unlabeled praises are things like, great, good job, love it, which are super warm, but it doesn't give specific information about which behaviors we want to see more of. If after we set the expectations, we're noticing any minor misbehaviors, which I think of as like really anything that kind of falls into the verbal category, whining, yelling, crying for no reason, that's when we practice ignoring those behaviors because a lot of times the function of those behaviors is attention. The reason why they're using that verbal behavior is to get our attention. And a lot of times those behaviors can stop if we as parents take our attention away from them. Again, we're thinking about the parental role in responding to these specific behaviors. From there, we can sometimes, make sure that we're giving effective directions. Again, that kind of goes with the clear expectations of exactly what we want to see. And then using any type of reinforcement system, like a reward, something tangible, while also, and then if that doesn't work, escalating to specific consequences. And the consistent piece here is really important. And that's why it's helpful to have this intervention delivered in like a weekly format where each week we're kind of going through a different strategy, but we're also problem solving how effective the strategy is at home and how well parents are using it and being consistent with what it looks like. So making sure that every parent in the house is using timeout in the same way that we want to make sure that they're consistent in what those expectations are, what the rewards might be, which behaviors we're ignoring, is one way to make sure that the skills are effective, right? That we're doing them consistently. And that's where that kind of coaching parental check-in piece can be really important. So PMT is a parent-only intervention. Oftentimes when I'm using PMT, I don't meet the kids, and parents sometimes are turned off by that, understandably, because the kid is the client and we're talking lots about them. But I think that, like, I like to remind parents that you guys are the experts in your child. I trust you, right? And we think about how effective and important it is for parents to be those agents of change. So working with you guys is shown to change those behaviors as well. So the evidence behind it is that it has shown that it is one of the most effective treatments for children with ADHD, and it has those long-lasting effects on the behavior change and, super importantly, parenting stress, right? So we're talking about how if we're able to be consistent with the skills that we are setting up in terms of the expectations, how we're giving praise, which behaviors we're ignoring, how we're using any type of reinforcement system and what those consequences are. We often see kids respond really well to that consistency, and we see behavior change where kids are motivated to change behavior based on either an interest in receiving the positive attention or a positive reward, or being motivated by trying to avoid a consequence. I think the parenting stress piece is a really important one here because certainly if a child is getting good at practicing any self-regulation skills in individual therapy, that can help change behavior at home, and that can reduce parenting stress because, like we were saying from the get-go, a lot of these ADHD behaviors do show up in the home and in those tricky family dynamics, right? Siblings, parents, all that good stuff. And so we want to make sure that we're thinking about how these behaviors are impacting the family system. A lot of times when I start working with parents, I ask them if there are any significant stressors that would be helpful for me to know about, either things that are spilling over into their child's lives, but also for the parents, right? Like things that might make it hard for them to use these skills really consistently. And a lot of times, a really big stressor for parents is the identified client, right? Is the patient, is the fact that their child is having these really disruptive behaviors at home and they're having a really hard time managing it. And so when we can empower parents to feel more confident in how they're managing those behaviors, that they have a consistent roadmap or a flow chart to address those behaviors, it has a huge impact on parent stress, which I think is a really important piece to think about. We also wanted to, some of the tools, like I mentioned, token systems, timeout, any of those when, thens, reinforcing positive behaviors. It's great for kids with ADHD, those like non-compliant or disruptive behaviors. PCIT, parent-child interaction therapy, is a live version of PMT in a lot of ways. It is, in this situation, I do meet the child, where I'm really coaching parents on how they're using those skills and strategies in a live form. So this is a good one to use over Zoom because I can actually see behaviors where they're popping up, which is in the home environment. And so this is a way to kind of coach parents on how they're using things like praise, how they're using things like timeouts in that live format. This is well indicated for kids ages 2 to 7. Like Mandi mentioned in the introduction, it's kind of the gold standard intervention for younger kids with these disruptive behaviors. It's focused on 2 different phases. In phase 1, we're focusing on child-directed interaction, or CDI, where we're using PRIDE skills, which stands for praise, reflect, imitate, describe, and enjoy or enthusiasm, which are different ways to focus on giving positive attention to positive behaviors. And we kind of think of that as like our first level of defense, right? Back to that positive antecedent that we think about in PMT as well. And so coaching parents on how they're using those types of skills does have an impact on child's behavior, right? And being able to see it live, I can give much more consistent feedback. Whereas in PMT, I'm really relying on parents to tell me how those strategies are going at home, which is just a little bit more challenging, right? Obviously, I trust you guys, but a lot of times it can be really helpful to see those behaviors live and give you the feedback on what those are. Because I get to sit over here on my side of the screen and say, like, oh, that's a praiseworthy behavior, or we're going to ignore that one. Like, John, stop talking. Kate, step back. And so those are ways to kind of make sure that parents are getting the live feedback on some of these strategies. The foundation for PCIT and PMT is really similar. In the second phase of PCIT, we focus more on the consequence piece of that ladder that we talked about, how parents are giving those commands effectively, and how they're being consistent with the discipline, for example, a timeout structure. And for a lot of times, that live coaching can really feel like the special sauce for a lot of parents, where they're getting that live feedback on how to use some of those strategies. Like I mentioned, there is a ton of evidence for PCIT, really shows substantial reduction in those disruptive behaviors that we think about in the ADHD category. And because we're practicing some of those active ignoring skills, where I'm saying, Danny, no talking, right? Just wait for the behavior to stop. Let's get ready to praise it. It can really show that enhancement in the emotional regulation, where kids are able to see that they can handle that, ride that wave, and we're all riding it together, right? And you have me in your ear telling you can handle it as well. Again, like I mentioned, the unique feature is that real-time coaching, that special sauce, but I think it also has this specific emphasis on the warmth, which is really important, right? So we're focusing specifically on the ways that a strong parent-child relationship and having that at the foundation is required in order to use discipline effectively. And I think that this goes back to like a lot of parents' goal when they engage in treatment for their child is to build kids' self-confidence, their self-regulation skills, but also just to have a more positive relationship and interactions at home. And so being able to kind of have that as the core and the root is crucial in terms of that parenting stress metric that we talk about, as well as, of course, changing the behavior. They actually did some randomized control trials where they tried to teach PDI, the discipline phase first, and then do CDI because parents usually just want the discipline strategies, and it was not as effective, which I think is really good, a good way for us to show that that foundation is crucial in the success of that. Okay, so the last parenting intervention that we're going to talk about specifically focuses on treating anxiety. So it is supportive parenting for anxious childhood emotions, SPACE. This is another parent-only intervention for treating anxiety and OCD. It was developed by Dr. Ellie Leibowitz at Yale. His book is phenomenal, highly recommended to everyone. It is called Breaking Free of Childhood Anxiety and OCD. And it talks a lot about that accommodation cycle that I was mentioning earlier with the dog phobia, right? Whereas parents, we end up reinforcing specific anxieties because we are concerned about kids' levels of distress in facing those. And I think that this, of course, shows up with ADHD as well, right? Where we're thinking about those disruptive behaviors and how we're trying to problem solve. And that's like our natural reaction as humans is to jump in and solve a problem, right? And fix it and make our kids feel better. But I think that, the reframe here is not how can we make our kids happy and free from any level of distress, but instead, how can we make sure that they're safe, right? So I think that's certainly a big piece of that. The core components of SPACE are thinking about reducing that family accommodation, right? So one of it might be, for families where the child is sleeping in the parent's bed, or we're avoiding those specific triggers like a dog or something like that. There are ways where we think about like this is a good intervention for families where the parents are playing a specific role in reinforcing that anxiety. We talk about increasing that supportive communication. Remember, that's the parent in the middle of the spectrum that says, I know this is hard for you, empathy, and I know you can handle it, confidence, encouraging bravery, grit, resilience, perseverance. And I think that this is kind of what I was talking about with that shift from fixing to coaching, right? Shifting our perspective from I need to fix it and make sure that my child is happy and free from any element of distress to coaching, right? To showing them that they can tolerate that because we all tolerate uncertainty, discomfort, and we want to show them that they can handle that as well. In Ellie's trials for this, it was shown that SPACE is just as effective in treating anxiety as CBT, cognitive behavior therapy, even without any child participation, right? So even without meeting the kids in any way, shape, or form. The specific examples that we think about are school refusal, any type of social anxiety, and separation anxiety. This makes sense if we think about the fact that like with separation anxiety, it's like specifically related to the parent-child relationship. And so being able to have the parent change their behavior in those separation moments can be really effective in addressing it specifically. School refusal as well. A lot of times parents play a role in reinforcing that. And same with social anxiety, kind of encouraging kids to be in spaces where they are challenging some of those anxious thoughts and behaviors in order to confront those fears. So SPACE is really good for, like I mentioned, those families that are accommodating those behaviors, but it can also be really helpful for kids who are avoidant, withdrawn in general, but specifically resistant to therapy. And we think about this as well with PMT and PCIT, more so PMT, because kids 2 to 7 don't always do super well in individual therapy anyway, just because it's really hard to generalize those skills. But if you think about like if you have a kid who is resistant to treatment, I like to think about parent work sometimes as like the first level of defense, right? Like they might be a really good candidate for individual work down the line. And there certainly are situations where it can be really useful for kids to be in individual therapy, build up their own toolbox, have a structured approach to facing those fears, even if it's in an office. Um, but I think that being able to kind of start with what changes can we make with the parents at home, the ones who are willing to participate in therapy, are engaged, you're the ones paying for it. I'm just kidding. But those are the ways that we can really kind of think about how parents are might be motivated for change, and that helps them be the agents for change in that way. We're going to leave a little bit of time for questions, but just in summary, we want to think about how parent focused interventions are really empowering for families, right? I think that like a lot of times it can be a little distressing of like, my kid is, not interested in going to therapy, or what he's doing in therapy isn't translating to these tricky situations. But being able to change your behavior can make to know that you're changing your behavior can make an impact on your child's behavior, I think is a really, really powerful thought. And to have that toolbox, to have that flow chart framework, roadmap for how to address some of these tricky situations and feel like you have it consistently is a really good way to kind of have that confidence. And certainly when we think about the different types of interventions, it's based on diagnosis or family needs and child participation. And there might be ways that we kind of use elements of different types of parent interventions to change behavior. But in general, it is a really helpful way to think about how we're changing children's behavior and also managing family stress. Mandi, I know I didn't leave us exactly 15 minutes for questions, but I want to make sure that we do get to them. So,
Yeah, absolutely.
thank
Not
you.
a problem. Not a problem at all. We are going to try and end at one, but we might go a couple of minutes over if we need to. So if anyone has particular questions, please feel free to send them to me in the Q&A box. Maddy, thank you. This was actually so helpful. And you clearly have been doing this and saying these things over and over again. I can see how much you know and can share. So it's awesome.
Thank you.
Um, so one of the things that you talked about early on was how individual therapy, is still the thing the thing that we both have talked about, the thing that people mostly think about when they're talking about sending their kid to therapy. Parent strategies are very helpful, obviously, but when do you think that individual therapy might be better or should still happen maybe after parent therapy? Like, can you help us with that a little bit?
Totally. Yeah, I think that there are lots of spaces where I mean, obviously there's plenty of evidence for individual therapy too, right? Like CBT, DBT, all that good stuff. And I think that it really depends on the child and the family, but I think that a lot of times, especially for kids that are treatment resistant, that's a space where I always suggest parent intervention as kind of like the first way to engage. But for a lot of families, it's just the first intervention, right? And so there might be spaces where they are well indicated to engage in individual work and build up their own toolbox. So if it starts to feel like, okay, the parents are using these strategies consistently and effectively, and things still aren't changing, that might be where I say, okay, let's talk about the individual work and have the child build up their own toolbox too. Or if a kid's really motivated for change, right, then that we know is a huge factor in success for individual work. And so I think it just depends on those specific factors. But I think that especially like for older kids where they might be better at generalizing some of those strategies, or might have more motivation to change because of different social pressures. Like I think a lot of that can contribute to when individual therapy is either indicated before a parent intervention or kind of as like the next step, if that makes sense.
Yeah, it does. I think there's also some like brain development questions here too. So, for example, a lot of parents reach out to us talking about helping their kids to manage big emotions and not get so flooded with anger or rage, well, anger, rage, sadness, um, and so they're looking for play therapy. But a lot of times when a kid is 3, 4, 5 years old, they just don't have the executive functioning like you were mentioning earlier. to be able to contain those emotions. And so, even with all of the tools and the vocabulary and the feelings wheels and all of that sort of stuff, when they are in that moment and their emotions have just like taken over their brain, they're not going to remember any of those things in the moment. So, some of it is developmental. So, because we really focus on cognitive behavior therapy here at Small Brooklyn, a lot of talk based therapies, we often recommend that kids don't start individual therapy with us until they are at a cognitive and verbal level to be able to really engage with that kind of talk, which can be then very effective. But if they're not ready for it developmentally, that's really important. And then
Totally.
the other piece feeds into another question that I just got, which is because the executive functioning that we need to be able to regulate emotions, a lot of that kind of difficulty, the executive functioning difficulty, comes in ADHD. So that when you're trying to help a kid to develop the regulation to not impulsively do something that's going to get them into trouble, for example, um, it is part of the diagnosis, part of the weakness and the neurodivergence that inherently makes it hard for them to do that and hard to participate in a talk therapy that's all about remember what you're supposed to do when you feel this impulse coming on. Well, by the time they've realized the impulse is coming on, they've already done the thing that they're not.
Yeah, totally. Totally. And even like without the impulsivity, like I was saying too, like I talk about coping skills all day long and I don't remember to use them in the moment all the time, right? So like
Exactly.
even with like my fully formed frontal lobe, it's hard, right? So I think it's sort of that like reminder that having other people in the family system to kind of coach to that skill and support you in that is reasonable and effective.
Like totally. And so this parent was asking, how are ADHD and disruptive behavior connected or related? So go ahead, why don't you take that one?
Yeah, I think kind of like what you were saying, where a lot of times ADHD is characterized by some of that like hyperactivity, impulsivity piece, where the disruptive behavior comes from that inability to control the impulse to do a certain disruptive behavior. Or perhaps like the inattentive side of it too, like not like paying attention to that like expectation setting, that positive antecedent that we talk about, and then parents getting upset when they're not responding to it, but it's seen as a disruptive behavior when it's really coming from like the inattentive piece. And so
Mm-hmm.
that's where we often see, and correct me if you have a different like take on that,
No,
but I
that's
think
great.
that's often where we think about how ADHD presents in these like externalizing disruptive behaviors and anxiety too, to a certain extent. I think we think a lot about anxiety as an internalizing disorder, but there's plenty of kids who are nervous about a math test and throw a chair at the teacher to get out of taking the test, which is an externalization of that anxiety that we often think of as more of like the meek, internalized anxiety piece. So I think that's where being able to kind of overlap certain behavior management strategies with space, bravery strategies can sometimes come into play too. But yeah, I think
Awesome.
that kind of thinks that's where we think about how ADHD, um, kids with ADHD might present more disruptive behaviors.
Mm-hmm. There is like a third way too that I see this in ADHD is that like impulsive behavior, but then there's also the excess energy piece of
Mhm,
hyperactivity
mhm.
of like not knowing how to regulate your arousal level and your
Yeah,
energy level. And so you'll see these kids who just really respond to the energy in the environment. And so they go to like a birthday party where everybody's running around and screaming and
right.
they get bigger and louder and they're now the biggest kid in the room and they are so on and so big and they just cannot manage their arousal in that way and then they end up doing something they just cannot control their bodies. So that's a
Absolutely.
third way that sometimes you might see, or like kids who are roughhousing at the playground, or with parents, or whatever it is, that might be something you recognize.
Yeah, absolutely. I think that makes a lot of sense.
Someone asks, is parent therapy a good choice for supporting a teen with inattentive ADHD who has problems managing homework and doesn't like school?
Yeah, that's a good question. I think that especially like the managing homework piece that's happening at home, right? So I'm always kind of thinking about like behaviors are best addressed in the environment where they're happening, right? So if there's a lot of like defiance, non-compliance around homework, which happens at home, then yeah, giving parents tools in the home to address those behaviors could be a really good place to start and a really good way to build those strategies and like consistent expectation setting, any types of like we were talking about reinforcements or consequences. In terms of the not liking school, I think there, are spaces where we might want to do a little bit more digging in terms of like, is it just that school's not always that fun? Is it the academic demands? Is it the social piece of it, right? And so if there are like as a result behaviors that are happening in the school, that might be a place to kind of tack on some school consultation to think about ways
Good
to
point.
better support them in the school as well. But definitely I think that like the not liking school is not necessarily like a behavior that we would modify, but that's where I would maybe want to do a little bit more digging and understanding, the overlap for the school piece. But I think that parents can do a lot in terms of like thinking about how they're talking about school, thinking about how they are talking about what they don't like about school, right? Like how they're feeding into any types of like negative
Mhm.
feelings or reports from school, right? I think, like again, parents have a lot of power in those interactions. And so I think it could be a space to kind of
How
tease that out.
parents how parents might be inadvertently allowing their kids to escape the things that they don't like about school.
Right.
So, for example, oh, my teacher is so mean. She always makes me do X, Y, and Z exactly this way. And the parent might be like, oh, you're right. That teacher is like so too harsh. You don't need to do that. And
Exactly,
yeah.
totally. Or like even a different like so that function would be like escape, right? But what about like the attention function of like you ask how's your school day? Kids say good, we kind of move on. Where if they say, oh, it was so hard, Mrs. So and so, like my friend did this, and it kind of can feed into that negative feedback loop too. So like
Mm-hmm.
thinking about what is the function of that report? Is it to get out of doing something? Is it because they get lots of parental attention for it? And that is a space where parents can be a big agent for change in terms of like how we're thinking about it too.
And how therapists can help you to tease apart what the actual function is, like you said, and what the different
Exactly.
components are feeding into it. It's a really good point.
Yeah, because understanding the function helps us understand how to address it, right? Because if it's an
Exactly.
escape function and we're addressing it like attention, it's not going to work, and vice
Yes.
versa.
Yeah. Yeah. Really good point. Someone asks, at what age is it developmentally appropriate to begin ignoring excessive whining, etc., so as not to reward tantrums with attention? And does the age change depending on whether your child has ADHD? Great question.
Interesting. Yeah, good question. I think that so PCIT is indicated for kids ages 2 to 7. And there is an element where we talk about like ignoring those minor misbehaviors. So like as young as 2 is kind of what the research shows can be effective in changing those behaviors. I like to talk to parents about how like a lot of it depends on like individual tolerance levels too, right? Like I like to think of myself as having a pretty high tolerance for some of those minor misbehaviors, although like maybe not for my own child, but like in my job. Um, but
Always.
like it's easier to hear other kids cry than your own kid. But I think that, again, I think this kind of goes a little bit back to the attention to the function piece, right? Where like if the function is attention, then it can be really effective to ignore it. And we're always talking about a skill called active ignoring, where it's not just pulling your attention away from the behavior, but the active piece is actually the most important part where the behavior change comes from. Where the second a behavior stops, if we say, thanks so much for calming down, or I love that you used a nice tone of voice, then those are ways to actually, that positive reinforcement is actually what's more likely to change the behavior than the ignoring itself. So I think that's like an important caveat, right? Where it's like, yes, just ignoring the behavior would help, but the real behavior change comes from that specific labeled praise to reinforce the positive. And so I think that's something that works for kids. I've seen it work for kids as young as 2. I think that, there is like a toddler adaptation for PCAT that doesn't focus as much on ignoring and focuses more on like calming, helping kids calm down, kind of giving support, a hug, like helping with that self-regulation moment. And so for some parents, that feels like a better fit when kids are closer to 4 than like 2 to start ignoring
Okay.
because just their individual tolerance for it. Like I wouldn't want you to like try ignoring a behavior and then just cave in eventually. So that's kind of what we're thinking about there. So there is some developmental piece, but also just like depending on individual family.
And I think that's really important. I think that, yes, we have these evidence-based programs. They do follow a certain model. We are following the evidence data here, but we are also flexible providers. They would work with your family to make sure that
Yeah,
it is something that feels good for you and your parental philosophy and
absolutely.
circumstances and things like that, where you're not robots and autonomous. And otherwise, you could just go to Chat GPT. You don't need us to tell
Exactly.
you
You could just read the book
that.
yourself. But yeah, I think that that's an important piece is like these are evidence-based, but they are personalized, right? And like I do want to make sure we're talking about like your parenting ethos and what feels good and what feels supportive and like how were you parented and does that, are you leaning into or away from that? Like those are all important pieces of the parenting work, which is again where I think about like the client is the child, but there are those elements of family therapy, couples therapy that like
Yeah.
I stay away from, but also lean into when it's appropriate to kind of think about how to best support the child, obviously.
Yeah, I'm sure it's a good balance. Just one more question since we're already out of time. How do you handle it when when the two parents are on different pages when it comes to how to parent the kids? I'm sure that you have encountered that a lot.
Yes, often. Well, I think that that is where it can be really helpful to lean into the evidence-based interventions to say like, well, this is what the evidence shows, like this is why reinforcement systems work and being able to kind of point to that, the specific theories and the data that has shown for that to be effective. And again, it's not to say that like we have to do it that way, but it can be kind of like a way, like an equalizer, right? To say like, you have one strategy, you might have another. Here's what the research shows is effective. Is there a way that we can kind of like mesh all of those three things together? And sometimes like parents do appreciate like the reframe to just think about like, oh yeah, like, I was doing it one way, but if there isn't any evidence to back that, like I can change my mind, or this is really crucial to my ethos and I don't want to use this skill that's part of this program, which is totally fine too. And we think about ways to kind of adapt it. And even like I don't know if this question was coming from like a coupled couple or an uncoupled couple.
Mm-hmm.
But like even within the same house, parents have different personalities and ways of managing things. So I think that like it's not that everything has to be exactly the same. It can be helpful to give like more consistency, but just to kind of feel like we're aligning on like the core elements of the strategy can be a good like starting point to kind of think about ways that we might tweak it.
That's good. Okay. All right, we do need to end, even though we do have a few more questions. I'm so sorry, but go to the next slide because if you want to talk to us more about some of the questions that you have, please feel free to reach out. That's our general website and email account, but also you can email Maddy directly, Maddy at smallbrooklyn.com. I am Mandi at smallbrooklyn.com. We get email for each other all the time.
Pretty good way.
Thanks so much for joining us. So this is our last scheduled webinar for this academic year, but I'm sure we'll be back with more topics in the fall. In the meantime, you can go to smallbrooklyn.com/services/talks to see our library of previously recorded webinars, which are all up there for free on the website. So again, always feel free to reach out to Small Brooklyn if we can help you. Thanks as always to Park Slope Parents for helping us to share information, supporting parents everywhere. Have a great rest of your day. Bye.
Thanks, everyone. Bye.